Planning for healthcare costs in retirement is one of the smartest moves you can make to protect your financial future. Many people underestimate just how much they'll need for medical expenses once they stop working. The reality is that healthcare costs tend to rise as you age, and without proper planning, they can eat into your savings faster than you expect. Even if you're in good health now, it's important to remember that medical needs tend to change over time. From routine checkups to unexpected emergencies, having a plan for healthcare expenses ensures that you won't be caught off guard. It also gives you peace of mind, knowing that you can focus on enjoying retirement without worrying about how to pay for necessary care. One of the biggest mistakes people make is thinking Medicare will cover everything. While Medicare provides essential coverage, it doesn't pay for all expenses. You'll still face out-of-pocket costs like premiums, deductibles, co-pays, and certain treatments or medications that aren't covered. Dental, vision, and hearing services, for example, are often not included. That's where planning ahead becomes crucial. You need to understand how much you can expect to pay beyond what Medicare offers and figure out how to fill those gaps. This could mean buying supplemental insurance like a Medigap plan, or choosing a Medicare Advantage plan that offers extra benefits. The earlier you research these options, the better prepared you'll be to manage your healthcare needs. When estimating healthcare costs for retirement, it helps to think in terms of both annual expenses and long-term costs. A good rule of thumb is to budget for higher medical spending as you age. Studies show that the average couple retiring at age 65 can expect to spend over $300,000 on healthcare throughout retirement. This figure doesn't even include long-term care, which can add a significant amount to your expenses if you need it. Long-term care covers services like nursing homes, in-home care, or assisted living facilities, and it's not covered by Medicare. That's why many retirees explore long-term care insurance or set aside a specific part of their savings to handle these potential costs. One way to make healthcare costs more manageable is to take advantage of health savings accounts, HSAs, if you qualify. An HSA allows you to save pre-tax dollars for medical expenses, and the money grows tax-free. If you don't use the funds right away, you can keep building up your savings for healthcare needs in retirement. The best part is that you can use HSA money tax-free to pay for Medicare premiums, deductibles, and out-of-pocket costs once you're eligible. If you still have access to an HSA through your employer, it's a great idea to contribute as much as possible before you retire. Another smart move is to create a realistic retirement budget that includes healthcare costs. Start by adding up your current medical expenses, including insurance premiums, prescription medications, and any regular doctor visits. Then, factor in the possibility that these costs will increase over time. Inflation plays a role here too, especially with healthcare. Medical inflation tends to rise faster than general inflation, meaning your healthcare expenses could grow more than you expect. Being conservative in your estimates is better than being caught short. It's also helpful to think about how your lifestyle will impact your healthcare needs. Staying active and healthy can go a long way toward keeping medical costs down. Regular exercise, a healthy diet, and routine preventive care can help you avoid expensive treatments down the road. That said, no one can predict every health issue. This is why having both savings and insurance is essential. Planning for healthcare costs isn't just about covering what you know you'll need. It's also about being ready for the unexpected. Medicare enrollment is another key factor to keep in mind. Signing up on time can save you from late penalties that increase your premiums. The initial enrollment period begins 3 months before your 65th birthday and ends 3 months after your birthday month. Missing this window could cost you extra for the rest of your life. Beyond Medicare, make sure you review your insurance options every year. Healthcare plans change, and what worked last year may not be the best fit for your needs now. Comparing plans annually ensures you're getting the best coverage for your situation at the right price. Some retirees also explore alternatives like medical tourism to save money on healthcare. This involves traveling to other countries for medical procedures that are much more affordable than in the US. It's not a solution for everyone, but it can be an option for non-emergency treatments. Of course, it's important to research thoroughly and ensure you're receiving care from a reputable provider if you go this route. For those who prefer to stay closer to home, managing healthcare costs can also mean taking advantage of free or low-cost community programs that offer screenings or wellness services. Planning for healthcare costs isn't just about numbers. It's also about making informed decisions. Understanding your options, from Medicare to supplemental insurance and long-term care coverage, gives you the tools to create a strategy that fits your needs. Healthcare is one of the biggest expenses in retirement, but it doesn't have to derail your financial plans if you prepare properly. Having a clear plan in place means you'll be able to handle medical expenses without stress, leaving you free to focus on the things that matter most in your retirement years. Conclusion: one of the main takeaways here is that planning ahead is essential. Healthcare expenses can be unpredictable, but preparing for them gives you more control over your retirement savings. Another insight is that Medicare alone won't cover everything, so exploring supplemental options is crucial. Additionally, small steps, like contributing to an HSA or staying active, can have a big impact on reducing costs in the long run. Finally, reviewing your healthcare plans regularly ensures you stay ahead of any changes that could affect your coverage. The more proactive you are, the smoother your transition into retirement will be.